Hello, Eliza Kanji. Alum. That's a fantastic way to prepare for your final exam. It's a pleasure to assist you with this mock interview for your Purposive Communication course. As a future veterinarian, clear and effective communication is essential, so this is an excellent exercise. I will now ask you 10 random questions covering the areas you specified. Take a deep breath and treat this as a genuine interview. Good luck. Mock veterinary medicine interview. Questions. 1. Understanding the profession. Beyond treating sick animals, what do you believe is the single most important role a veterinarian plays in public health?
By being a veterinarian is not just by treating our patients, but also comforting and reassuring our clients.
In a single sentence, what was the defining moment or core reason that solidified your decision to pursue veterinary medicine at Southwestern University, PHINMA?
To one day provide the veterinary clinic that our municipality lacks.
3. Basic patient care. You are assisting with a hospitalized patient. How would you prioritize the key parameters you need to monitor and record during a 30-minute observation period?
By being as attentive as possible and being observant to the every detail that occurs.
4. Client interaction. Difficult scenario. Imagine a client is visibly upset because they had to wait over an hour past their scheduled appointment time. How would you initially address their frustration while still maintaining professionalism?
By being as patient as possible and still having the proper attitude towards your clients.
5. Safety. Zoonoses. Name one common zoonotic disease a veterinary professional is at risk of contracting, and briefly explain one specific precautionary measure you would take to prevent its transmission.
A great example would be rabies, and one precautionary way is to educate the people on how to take care of things, especially when they get bitten.
Ethical considerations. A client is insisting on a specific, very expensive diagnostic test for their pet that you, the veterinarian, believe is unnecessary and provides little clinical value. How do you handle this disagreement, ethically and communicatively?
By communicating effectively and explaining every necessary details that is needed in order to change or persuade the client.
7. Basic patient care, pain recognition. Give 2 nonverbal signs that a cat who is recovering from a routine surgical procedure might exhibit to indicate it is in pain. 8. Professional resilience.
One behavioral issues will be that the cat is overly aggressive and but at the same time is very droopy.
The veterinary profession can be emotionally taxing. What is one personal strategy you plan to employ to maintain your mental well-being and avoid burnout?
By improving my time management skills.
You see yourself practicing 5 years after graduating and passing the board exam? And what specific impact do you hope to make in that area of practice?
I hope to become a reliable veterinarian that is able to provide the necessary needs that each of my client needs.
Best of your ability. I look forward to hearing your responses.